all that they have done to keep us free. Just as an aside here locally, and really our awareness of what we are going to have to prepare for as Afghanistan scales down. In the district not too long ago, we had an event, and really we co-sponsored it with Syracuse University, and it was an attempt to say, look, the Veterans Administration cannot do it itself. We as a community have to be ready, willing, and able to help our veterans when they get home. They need to have health care. They need to have mental health care. They need to have education if they want to go on. They need jobs. They need a support system. They need the faith-based community to be there to help them. So that's what we did up at the On Center, actually, with Syracuse University. And it was well attended. It was bipartisan. We had the local Democratic elections there along with the Republicans. And that's the beauty and really one of the great successes, I think, of the Congress is how the House comes together to make sure that the veterans get exactly what they need. And we will continue to do that. There's nothing more important than that. I also want to just quickly ask my staff to stand up. Just about the whole staff is here. Buerkle in the back of the room, I just want to say that Buerkle is an Iraq, Afghanistan Army veteran, and he handles all of our veterans as well as our military issues. We're so fortunate to have Buerkle with us. We thank him for his service. Next to Buerkle. I should say on either side of Buerkle is Joe. On this side of the camera, Brandon Jackson and Caitlin. Caitlin and Brandon are out of the D.C. office. Along with Tim Drum is over on the left. Tim is my chief of staff from Fabius, New York, but is my chief of staff down in Washington. Nancy Lowry here is my district director, so she's my eyes and ears when I'm in Washington. So any complaints? And then over in this corner is Lynn. Lynn handles all of our immigration. She just went through a very intensive program in Washington, handles all of our immigration issues, and does a great job. Next to her is Cheryl Ross, and who just appeared in the doorway there is Shirley. And Shirley handles all of our senior issues and our Medicare issues, and is a nurse in the healthcare industry, and really does a phenomenal job. And I must say to you, a year and a half ago when I ran, and we were successful, we came together as our organization was, we were forming our organization. We said our #1 priority is going to be constituent service. Because when you only control one house in Washington, you really have an expectation that a whole lot is going to get done. There's going to be a lot of discussion and debate, and we'll get into some of that. But what we can do is a congressional office. What we can do effectively is to make sure when someone calls our office with a Medicare issue or a veterans issue or an immigration issue or a Social Security issue, they get service. And that's what my Syracuse office does such a fantastic job. Roxanne McMaster isn't here. She's a former employee. She worked at Beer House for 16 years before she came over to us. I have a staff who understands constituent service and advocacy. So we understand the work for all of you. You may not agree with me. You may not agree with me on any of the stuff, some of the stuff. But we are there for every person in this district. And when we have issues, we hope you'll call us and we'll see if we can help you out. So with that, I was going to stand up here and say to you, well, let's know if there's anything going on in Washington. But I must say, disappointed with the Supreme Court decision. I thought that the court would find the mandate unconstitutional under the Commerce Clause, which they did. But what I didn't expect is that they would say, okay, healthcare laws and tax, it's constitutional because Congress was and that's what the court said. Every American should understand what that means.
If that doesn't work, she's very happy.
I know folks.
I know.
But I will say that I think not only is the Affordable Care Act not good for health care, because I don't think ultimately it's going to decrease the cost of health care or increase access to health care. I think it sets up a tremendous bureaucracy.
What's your name?
Probably 75%
The state party. Which state party? Democrats. Oh, okay. That's great. Thanks for being here, man.
Long before the Supreme Court called it a tax, well, it was a tax, it was argued as a tax. And I think that there was a lot
It's not a surprise to you.
misrepresentation. When the White House said it's not a tax, it's taxes on anyone who earns under $250,000. This law, this law, this law is the largest tax hike on middle class income. And I have my concerns about the concept of the government being involved in health care, and that we should have the Affordable Care Act, and we can talk about all of that. But I think we need to, as a nation, recognize the fact that 75% of the Affordable Care Act will be paid, those taxes will be paid by those earning $120,000 or less, middle class America. They are going to they've taken the baseball bat to the stomach. The middle class will support the Affordable Care Act. And the reason I say that is because the poor, and rightly so, are on Medicaid and they don't pay taxes. So it's not going to affect them. And the wealthy can afford the premium, they can afford their health care. Some of the wealthy can even afford to go and pay for their total hip replacement without having insurance. They can just pay. And some choose to do that. But the middle class, those who, a young married couple who is working and can't afford health care, as the premiums have gone up, and we've seen in the last year premiums, here we've seen Post-Standard wrote an editorial, the rates have gone up about 9% in 1 year. So young couples who are married, both working, can't afford health care, they choose not to, now they will be taxed. And the tax is a gradual tax. First year, a couple, I think, will probably pay around, I think it was $280 was the estimate for the penalty for tax. But in 2014, it'll go up to $2,000. So it's initially, it doesn't sting, but very soon after the law is implemented in 2014, it will be, there will be a significant tax that middle class will have to pay. The other problem I have with this law, and it's no surprise to those of you who have followed me around and have listened to me and who are part of the campaign and have attended another town hall, is my concern that the government is now involved in relationships where they should not be involved. Now those in the audience, and I think this is a very important debate that we're going to have. It's what the elections are going to be about, and I think, quite honestly, the court, many thought the court was going to be the remedy, it was going to be a judicial, remedy for the judiciary, but instead now it's going to be, and Justice Roberts said it very clearly, we don't establish policy. We don't tell you whether or not this is good health care policy. All we can tell you is whether or not it's constitutional. They found it constitutional because they called it a tax, and they said Congress can levy a tax. But my concern with this law, whether you like it or not, and the debate we're going to have this November, is that it flies in the face of what the United States of America is about. And we have come so far from what our founders intended this nation to be. And I think this time of the year, we're getting ready to celebrate July 4th and our independence. What were they thinking when they wrote the Declaration of Independence? That we are endowed by our Creator with certain unalienable rights, among those life, liberty, and the pursuit of happiness. Now, John Locke always was talking about property. But Thomas Jefferson's belief was that, no, we're not a materialistic country. We're a moral country. And we make our argument for freedom on a moral basis. That the United States is the greatest experiment in liberty. And that's what the Declaration of Independence was about. And we have come so far from what our founders envisioned this country to be. They had in their mind that the government was going to protect our rights. Many fled to this country for religious freedom.
all kinds of reasons of freedom, so they could own their own property, so they could be here and leave and act and do it as they wanted, and not be under the tyranny of the king. So Thomas Jefferson in the Declaration of Independence and the Founding Fathers, their vision was, this government protects our rights, not grants our rights. And we've come so far from that. If you look at just the health care law, now we need health care reform in this country, and we need to make sure that the poor are cared for in this country, because that's the United States of America. But the Affordable Care Act doesn't do that. And it takes away freedom, and it takes away choice. You know, you read employers, 30% of the employers will probably allow their employees to go into the exchange and not cover their health care. So when the president said you will be able to keep your own health care plan, that in fact is not true. Because many employees will be put into the exchange and their employer, because it's cheaper, it's just a business decision. It's cheaper to pay the tax than it is to pay for health care insurance. So as we celebrate July 4th, I think when we have these debates, and certainly the presidential election, certainly my election, it's going to be about what we want our nation to look like, what we want our government's role to be in our lives. And I think that is the fundamental debate that will occur this November and that will continue to occur. And many will argue, you know, when I go around and I talk to my business owners in the district, small businesses, these people work so hard. They sacrifice their savings. They try to grow a dream. And everywhere they look, the government is in their way. With a new regulation, a changed regulation, a regulation that impedes their success. And whether it's EPA or Department of Labor, you talk to them about, and they deal here locally with not only New York State, not only Washington, but New York State. It's onerous to be a business owner in upstate New York. And so the role of the government should be, you private sector, you business owner, you're the solution to this. We want to make sure you can be successful, because that's what America is about. That's what they thought and they dreamed and they envisioned when they put the pursuit of happiness. The right of every individual to have the opportunity. When we talk about the American dream, that is the American dream. It's someone who grew up in Auburn, New York in 1969. I went into my guidance counselor, Sister Dolores Sand, and I talked to her about what I was going to do after high school. Now back then, in 1969, always your first option was to go into convent. And then after that, you could go to secretarial school, and you could become a nurse or a teacher. But no one ever no one said, well, you can dream big, because that was 1969, and that's small town America, that's what you were offered. But because this is America, and because I was willing to work hard, because Syracuse University had a great program that they allowed non-traditional students to go back to school. When I was 40 years old and I had 6 kids, I could go to law school. That's America. And making sure that everyone has those opportunities, and making sure the government gets out of the way and encourages that spirit. So many of the government policies are wet blankets on the entrepreneurial spirit of this country. And so many of the government policies, they deter this earned success. This concept of we're happy when we're productive, we're happy when we achieve a goal, we're happy when we grow a dream. That's earned success. And I would argue that people are more content, more happy, more satisfied when they have earned success, rather than when someone hands out a welfare check, or they hand out a food stamp. And I think we've dampened the essence of what America is, and we break the spirit of every American when that's all we do. We just say, we're here. Here's your welfare. We've grown welfare, we've grown the food stamps, the cost of this country, but worse than the cost, it isn't the cost. It's what it does to the American spirit. The message to someone that they can't, well, they're capable of this welfare. You're never going to break that cycle. We should be empowering. What the government should be doing, and what we as a community should be doing, is empowering people to reach the highest goal that they can in their life. Whatever that goal is for them. Some want to start a business. Some want to work 9 to 5. Some just want to stay home and be moms and raise their kids. But whatever their goals are, we as a country ought to be helping them to achieve that goal. And we don't help them to achieve that goal with regulations, programs that stifle that American spirit. And so that's really, I'm getting pretty far from where I was talking about when we were here. That's one of my big issues with the affordable care, is that it just is not fair. And when, on a practical level, when I talk to my hospitals, I talk to my physicians, and I talk to seniors who cannot find primary care physicians any longer, and I talk to small business owners who are going to either put their employees in the exchange, or they're not going to hire up to that 50th employee, even if they need them, because they don't want to pay health insurance. I say to myself, okay, as a nation, we need to reform our healthcare system, but this bill didn't do it. This bill is not cut costs. This bill is going to raise taxes on the middle class, the American people. This doesn't keep the cost of healthcare down. This doesn't improve access. So I say, this is Justice Roberts says, we need to go back to the drawing board. He's not saying it's good policy. All he's saying it's constitutional because Congress is really intent. So with that, I think there's probably lots of questions. I've got 2 questions, and we can talk about some of the other issues. Hey, Dan. We're going to start handing out prizes with first the most top policy. Dan, I think it's first one. Almost all of them.
The first question is from Gian Ziegler, Mattydale. Healthcare is declared constitutional by the judges. How can we eliminate the present governmental health care Obama wants mandated? Is Gian here? Is that it? Okay.
Well, I think what I mentioned during my comment